It repulses me.
How's Sally?
Dead.
I don't believe he was trying to make me a better doctor. He was trying to humiliate me.
You can have your inheritance on one condition. You leave here and you don't come back.
If you think coming back to work after a week's maternity is something to celebrate, right, after 7 nights, no sleep on the trot, you two are well mistaken.
Yeah, but I bet you're loving it, though.
Yeah, every minute of it. If I fall asleep, one of you bounce something off my head, will you?
Yeah, how many photos do you reckon he's got? OK, don't dab it, put some firm pressure on it.
Looking good, young lady.
Have you never seen a woman in a suit before?
Not this woman, exactly. How are you feeling?
Fine.
Good luck.
I don't need luck. What?
I want to be.
Yes, I know you've had a long wait. Someone will come and see you as soon as they can, OK? Oh, this is madness. 2 doctors down, and then Charlie's off to that hearing. Oi, Mac's been asking to see you.
Yeah? Oh, help us out here, man. The man's driving us crazy with the request for stuff. He's complaining about the food. Let's see what I can do here.
Dr. Hannah, we're swamped in here.
Louise, trust me, I'm doing everything I can. I'm on to management for a new consultant, and I have got a registrar locum who's covered today.
Does he hear you?
Well, I'm afraid in the meantime, you're just going to have to go in and bear it. Tell me you're not going anywhere anytime soon.
Not I can help him.
Oh, sorry, I forgot. How are you feeling? Have you got a good union, Ray?
I didn't ask for one.
Why?
I didn't do anything wrong. Besides, with Lily leaving us, sure the trust will see sense and the whole thing blow over.
Hello? Yeah. No, don't worry. I'm nearly there. I know, guys. You feel my pain.
What's in the box?
What do you think? You should make him sit up and listen.
Sally Jenks began to hemorrhage postpartum. Like any concerned doctor, I decided to investigate the cause. Dr. Ashford came back into the room, saw what I was doing, and ordered me out.
For what reason?
He didn't want me to re-examine the patient.
Why? Because you could have made the situation worse?
Yes, but that wasn't the case.
In your opinion?
What was I supposed to do? Let her bleed to death?
Let's just stick to what actually happened.
Dr. Ashford found me in the staff room afterwards and became quite verbally abusive. I asked him how Sally was doing. He told me she had died.
With the implication that you were responsible.
Okay. Your new mantra. Repeat after me. No more gunpowder cocktails in high heels.
Caleb.
Nibbles.
How are you doing?
Well, look at me.
Yeah, I can see that genius. The point is, you said you'd go. Well, I gave you that money so you would
That's in
leave.
case of needs must, I'm afraid.
There are so many other hospitals.
I'm getting to quite like this place. I know my way around, and the natives are extremely friendly. Well, most of them.
Listen to me. You're not doing this to me again, do you understand?
Doing what?
What are you scared of? Stay out of my way.
Come every night you think everything's just magically cleaned up around you. You leave your hair all over the sink when you've had a shave. Will you back me up here?
I had noticed a couple of times. Scud.
Yeah, see what I mean? And don't even get me started on the underneath of the toilet seat.
Can't live with them, can't live without them. Sorry? Rob him when she gets that bit between her teeth.
Right, let's get a few things clear. That's my stepsister you're talking about.
Oh, I'm sorry.
There's got to be another way.
Like what? Stand at the entrance waving a banner as they drive right past us?
No, of course not.
If those lorries get onto the site today with their equipment, that is it. It's game over. The fracas have won.
No,
I am done with passive resistance. I want to get their attention, make them stop. Trust me, I can think of far worse ways than blowing a few tyres. Okay? you help me? Rob, what are you doing?
I want to see if he's all right.
Come out! Quick, come on!
Come on, we need to get out of here.
No, I can't just leave him. Right, it's okay, you go.
Eve! Come on! Eve, come on! Get in the van!
Yeah, mate. So I'm going to get you out, all right?
Hurry!
I'm going to be on, he's trapped. Get rid of that. We got you.
So what is it, some kind of army thing? Loyalty until death?
It's Mike, sit down.
No. Seems to think he's doing you a favour.
Rita, meet Frankie. Shake it on, put it.
Watch yourself with this one, Reed.
Oh, yeah?
He's been complaining about back pains and he's had sickness and diarrhea since the early hours.
I fancy a day out of prison disorder.
What?
3006 on our way over. Right, Rita, we'll have to leave you, I'm
No
afraid.
problem.
Wait, I'm gonna have to do a security check. Are all the nurses as pretty as you?
Do you know, I don't think they are.
Both Chargenus Fairhead and myself told Dr. Chow not to attempt any kind of investigation.
Why do you think she ignored you?
She's headstrong, wants to prove herself.
I'm guessing you're not big on someone challenging your authority.
That's not what this is about.
No?
I wanted her to know that her actions had consequences.
By telling her a patient had died.
You adapt your style to your mentee. Dr. Chow is plain-spoken, doesn't mince words. I found that subtle direction wasn't quite working.
Lying to a junior doctor, that is a pretty big breach of trust. Wouldn't you agree?
Help! Please! Please help him.
Okay. Right, tell me not to take it from here. Right, love. I'm Dixie. I'm a paramedic. What's his name?
Paul. Paul Evans.
Right. You hurt yourself anywhere? Right, have you got any pain in your neck?
No.
Okay, that's good. Now, I need you to stay nice and still. I'm just going to examine you, okay?
That looks nasty.
It's fine. Don't worry about me.
It's your boyfriend. What happened?
We just saw the crash. Paul pulled him out.
The hero, then, young man.
Right, there's bruising to the chest wall, especially on the right. Okay, Paul, I'm just going to have to listen to your chest, my darling.
I've only got a couple of months left on my sentence.
Yeah?
HMP Stonebridge. Maybe you could write to us, get to know us better.
I'm not a big letter writer.
So just send us your knickers then, that sort of thing. I'm not fussed.
Trust me, you are asking the wrong girl.
Where's that then? Got a husband or something?
Something?
Either you have, or you haven't. What did he do? Run off for a younger model?
He's dead, actually.
How's it going?
Let's just say I'm glad you're here.
Not bad. You will get through this.
I shouldn't be the one on trial. Lily has no self-awareness. She just doesn't get it.
Right.
Where's Zoe?
Look, mate, she's asked me to help you out in recess. Boss's orders. After you?
Right, this is Paul Evans, 32. He rescued the driver from a tanker involved in an RTC just before it exploded. We cleared his neck at the scene. He's got some bruising to his chest, suspected fractured ribs. GCS is 15, pulse is 80, BP's 120, over 60. His SATs are 98 and his rest are 28. And I've given him 5 of morphine. OK, look, you just roll your ball over for me, please, darling.
Right, thanks, Dixie.
OK.
Okay, Gordon, I see you refuse spinal care.
Well, it's sets from 98 on route. They're dropping it down to 87.
I'll look after these two flights to see what it looks like. All right, can you open your mouth, please? Airway patent.
Let me take a look at that wrist of yours. Maybe fractured. No, I need to stay with Paul. I need to know he's okay.
It's okay. I'll keep an eye on things.
Let's get this top off so we can listen to your chest.
Breath sounds a bit down on the right. Can we arrange an urgent chest x-ray, please? Sounds a bit dull. I think you may have a hemothorax. Start prepping for a chest strain. OK, Paul. I think you may have collapsed the lung, so we're going to do a couple of x-rays. Don't worry, you'll be fine. Can we increase CO2 a bit, please, Fletch? Any medical problems I should know about?
No. Good. Is he going to make it?
Let's hope so.
She overstepped the mark on numerous occasions. Carried out procedures way beyond her capabilities, having been instructed not to.
That may be so, but the purpose of this hearing is to examine Dr. Ashford's conduct, not Dr. Chow's. Do you think his behaviour was justified?
It was a difficult
You
situation.
haven't answered my question.
Ash is a good man. I expect in the heat
So
of the
you
moment...
agreed with what he did, is that what you're saying?
His reaction may have been a bit harsh.
Yes or no?
Well, no.
All right, just take it. Relax. Do any history of heart problems?
No.
Are you taking any meds? Any beta blockers or anything like that?
No. Pulse is 35.
Okay. Can you repeat the 12 lead and I'll give him 500 micrograms of atropine.
You all right?
OK. I'm just going to get the doctor, right?
I don't get it. Why didn't they just stop? I need a break.
I don't know. What have we done, Eve?
I didn't want someone to end up like that.
What if he dies? What happens then? Have you thought about that?
I need to get out of here. As soon as you're fit, we're leaving.
OK, Paul. This is a repeat x-ray of your lungs. As you know, you had a hemothorax, but it appears to be settling well. Any news in the group-specific blood yet?
Just done that?
Great. Let's run a unit of blood over an hour.
Any tenderness there?
That's nice.
I'll take that as a no. Just gonna listen to your chest. Those rests are a little high. I'll have to do a blood gas.
Oh,
Is it sore there? Had things like before?
no.
Any alcohol or drug dependency?
No. Clean as a whistle.
Oh, well, let's hope so. Do a proper abdo examination now. Thank you.
How are you feeling, Gordon?
I hate hospitals.
Okay, well, I've had a word with the cardiologist, and I'm going to see you because your heart's been dropping its pace and going dangerously slow. Now, it says in your notes that your GP advised you to see a specialist over a year ago.
And doctors.
Anything you do like?
Pigs.
You like pigs?
It was the pigs.
What?
Pigs. It was the pigs.
Let's get this on top.
Whoa, I don't feel so good.
What is it? What's wrong? Help him.
You're allergic to something. Can you open your mouth, please, Paul? You're burning up. Have you any allergies? Any medical problems you haven't told me about? Does your throat feel tight? Do you feel lightheaded at all? Yeah. We need to stop the transfusion, remove the blood in the giving set as well, and send it back to the blood bank. Right, let's get him some saline and give him 0.5 mils of 1 in 1,000 adrenaline, 10 milligrams of chlorphenamine, and 200 milligrams of hydrocortisone IV.
What's the problem?
He's having some sort of reaction to the blood.
What was it? O negative? Who's specific or cross-matched?
The cross-match was ready.
Oh, who put the blood up?
I did.
Well, don't tell me you put it up without checking with the nurses.
What?
Well, did you or didn't you?
No, I don't know.
You don't know?
Look, just get off my case, will you? I can't think straight, please.
Dr. Hardy. Dr. Knight.
Zoe, sorry, it's under control.
I don't want to hear it. I will not have my staff shouting in front of patients. Do I make myself clear?
Yes.
Crystal,
If you two can't work together, I'll get another locum.
it was just a misunderstanding. Right, Deacon?
Right. Thank you.
He has no faith in my abilities and puts unnecessary boundaries. A few months ago, he complained when I successfully removed a shard of wood from a patient.
Without a surgical review, risking severing the patient's popliteal artery.
Let Dr. Chow finish, please.
He has this obsession with me being more empathetic with patients.
Is that something you find difficult, perhaps?
I'm a doctor. My role isn't to soft soap. Blood gas to show a high onion cap metabolic acidosis.
So he was something.
No way. I just wish I knew what was causing it.
Some underlying condition.
This is not diabetic and there's no sign of infection.
No, and there's no history of any solvent abuse.
Frankie,
Break it to me. Chant these off.
is there something you haven't told us? Is there anything you've taken that might have brought this on?
No.
Any previous illness in the past?
Flu. The
Oh,
one.
come on, Frankie.
Any family history of kidney disease?
That'd be the yesterday problems.
Look, we haven't got time to mess about here. Is there someone who might know? Can you call a family member?
The governor is not going to allow something like that.
I don't think you realise how serious Frankie's condition is. We're going to have to keep him in and monitor him very closely.
Doc says you can call her Frankie there. Who do you want to call?
Ghostbusters.
It's just your mum, isn't it?
I suppose it'll have to be here then. Don't say I didn't warn you.
Right, can I leave that with you, Rita?
Yes.
Good, the rash seems to be fading.
So how long before we can leave?
Leave?
Yeah, I was just curious.
Sorry, Paul's not going anywhere for quite some time. I've already paged cardiothoracics. As soon as he's stable enough, we're going to transfer him to a ward upstairs. An action like this is pretty unusual. How did you get this?
I was, doing stunts on my bike.
Bit of a daredevil as a kid.
I was, showing off.
Eve, can I take you away now so we can get that arm of yours sorted?
Won't be long.
Earlier on, I noticed another faint scar on the back of your pelvis. Have you had a bone marrow aspirate?
Leukemia. When I was 8.
Does she know? If you've had multiple transfusions, you'll be carrying all kinds of antibodies. I'm going to need your medical notes and where you were treated.
I can't do that.
Look, whatever the problem is, whatever you're hiding, you don't have a choice about this.
Okay. Can you get my phone?
Understood.
Is that Frankie's mum? Is she coming?
After that conversation, your guess is as good as mine. According to the governor, she's never once visited him in prison. Not in 2 years since his trial.
What? Don't tell me. She's at the shops, getting her hair done. Wouldn't want me dying here putting her out.
Give me the number.
Sorry. Have you Eve's x-ray, please?
We haven't done that yet. I've just got her HCG back. Do you need a moment?
Please.
Today's not been exactly how I imagined it.
I kind of got that. Did you know you were pregnant?
I thought I might be. A couple of weeks.
Have you told Paul?
No.
You don't think he wants a baby?
I don't know. I just got this feeling that he's holding something back.
I'll have someone sort your x-ray. Okay. Excuse me. Sorry, you can't be in here.
A lot more comfortable, but it may make you feel a bit sleepy.
Right, if you need to interview him, you're going to have to
With
wait.
his doctor?
Yes.
Well, then I suggest you let Rob decide.
Rob.
Better? Heart rate's improved in everything. Blood pressure too, which is just what we want to see. Stop will be next. And we'll PCG again, same thing.
What the hell happened?
All I knew is that the trucks were bringing in fracking equipment this morning.
When did you hear?
Late last night.
So you knew they were planning something?
No. But I had my suspicions, which is why I went down to the site to find out what was going on.
And what did you see?
Nothing. By the time we got there, it was too late. The crash had already happened.
You and Eve. The woman who's dedicated her life to making things hell for companies like Norva. You're telling me she was just some innocent bystander?
Yes.
But the driver?
He's in a pretty bad way.
If he dies, Rob, I find out you've been lying to me.
No, I haven't.
I may not be able to protect you. Do you get that? What that could mean for you? The guys in Blue are on their way. I'll do what I can. Keep a lid on things.
Thank you.
Excuse me, wanted these?
Thank you. You're a police officer?
What you just heard is strictly confidential. It doesn't leave this room.
Lily has a lot of great qualities. Huge energy, drive. But she lacks one important thing. Empathy. I've tried all different ways to encourage her to relate better with patients, staff. When I found her re-examining Sally, I thought I'd wasted my time. Her need to prove she knew best was more important than a patient's life.
Maybe I was wrong, but you had no right to do what you did. Sally had just had a child. She was vulnerable and she trusted me. And you made me think I'd killed her. Do you have any idea how that felt? You let me down.
I'm sorry.
I think we'll end things there. We'll reconvene once we've made our decision.
He's getting bradycardic again. Heart rate's 38.
Changes on the monitor and look a bit ischemic. Right, let's get him a bit flatter. And let's repeat the 12 lead in a sec.
It wasn't my
Good,
fault.
again, just stay calm for us, okay?
There's something in the road. I'll slam.
Okay, let's get the external pace on him.
Heart rate 36. I still can't find a BP.
You need to level with me. How long was he trapped in that cab?
A couple of minutes. We got to him as soon as we could.
So you were there when it happened? That's not what you told your boss. Did he see you?
Okay, all connected.
Not our faces, no.
Someone update the meds and tell them this.
We were wearing masks.
Did you cause the
I
accident?
tried to stop them. I didn't know they had a stinger.
Who's they? Eve. So what does that make you, a spy?
You don't understand.
You're lying to her and to your boss.
I have no option. I can't lose Eve.
What happens when she finds out?
She won't.
So what are you going to do?
The only thing I can do is stick to my story. You've got to promise me you won't say anything to her. Please.
What is it? What's wrong?
Keep in mind, I think it's set over 2. Robin, can you fast forward the med reg and let them know we've had to start externally pacing him?
Right, this is us. It's a lovely meeting you.
Mrs. McFarland, I'm Rita. Will this take long?
I don't know. Frankie's condition is deteriorating
I just
and...
need to know if it's as serious as you said on the phone, so...
Yes, this is very serious. He's got to have further investigations. Stomach x-rays, scans.
Mum? Well, talk to me.
You want me to speak to a doctor?
Dr. Hannah.
Mum?
All right. Just slow your breathing down for me. Just focus on your exhalation. Slow your breathing down.
So what would have happened if the last patient needed oxygen?
They didn't.
If you knew the cylinder was empty, why didn't you replace it?
Look, I made a mistake. What's the big deal?
Can't have you on a job like this.
What's that supposed to mean?
Whatever's going on in your head, whatever's happened between you and Mac, sort it.
She's right, mate. You are all over the shop. Oh, thanks for the tea, Jeff.
She could barely bring herself to look at him. What did Frankie do?
All I know is it was a vicious attack on someone he knew. Pensioner, I think.
How long was he in for?
Officially another year, but he's up for parole next month.
Will he get it?
That depends. They look for stuff like whether he's shown remorse and what kind of support networks he's got on the outside.
Like his mum? So it helps him, her being here today?
Yeah.
Okay.
It's clear, Dr. Ashford, that you had valid concerns regarding Sally Jenks' care. And the fact that you have shown remorse is commendable. That said, the Trust cannot be seen to condone this kind of conduct. Your behavior on this occasion fell wide of the mark. For this reason, I'm issuing you with a formal written warning. Do you have anything to say, Dr. Ashford, before we finish?
See those white areas there in your stomach? That's residue from tablets. The thing is, only certain tablets show up on x-rays like this.
Yeah?
Yeah. And given your symptoms of severe vomiting and abdominal pain, I'm thinking they're iron tablets. Frankie, I can run more tests to confirm it, but in the meantime, you are going to feel a whole lot worse. Did you take iron tablets? Fine. Let's get into HTC, get a serum iron and a total iron binding capacity, and start on destrioxamine 50 milligrams per kilo per hour. I'll see you in there.
Wait, I need to speak, sir.
Okay, it's going to have to be quick. Medics want to do an urgent echo and angio to find out what's going on.
Did you see them? On the side of the road. The masks. Freaked me out. Made me crash. Why doesn't anybody believe me?
I wish we could help, truly.
If you think it was my fault, if you think it was my heart that caused the crash, I'm going to lose my job. That job's my life.
What is it? Do they know something about the accident?
Just don't. There's a man in there who's just cheated death, and now he's terrified he's going to lose his job. I know. What's to do something?
What I said before about Robin. Yeah, it was a bit of a side blow, that. Don't know where it leaves us.
Obviously, I'm joking. She drives me mad. So all we need is a plan of action. Next time she fancies one of her rants. How about a code, a signal which means get out of dodge? Yeah, could work. So, like, got to feed the tortoise. Hope to. Have a time. Interesting.
You all right? I know. Poor guy. Fights for his life and then finds out that, well, that it's been taken away from him.
I could change things.
I doubt you could get his job back.
I should get back.
Have you told Rob about the pregnancy yet?
No. You know his name?
He had to tell me. With a complicated blood history like that.
What do you mean?
As I said, that kind of reaction to being given blood is pretty rare. Which is why we were so grateful his friend dropped in and gave us everything we needed.
What friend?
Jackie.
I don't know anyone called Jackie.
Right. Sorry, I probably shouldn't have said anything. I should go. You were right. There was no excuse for what I did.
I shouldn't have let it get this far.
Well, it's your last day. Let's just leave it there, yeah?
Deal.
This is where I should sit you down and do some kind of exit interview.
I don't think we should.
Very talented, Dr. Lily. I never doubted that. Maybe the ED just isn't for you.
What do you mean by that?
Well, your placement here hasn't been a great success. Maybe you're more suited to dermatology or whatever you decide to do.
So you think I've failed?
Zoe, looks like you were right.
Oh, his serum iron's greater than 100 micromoles per litre. He's severely iron toxic. Frankie, no more jokes. How many tablets have you taken? Where did you even get these tablets from? Are you anemic? Is he anemic?
He's stalemates. I think he might be.
And typically, how many would he have in his possession?
I don't know, maybe a week's
No,
worth.
no, no, I'm pretty sure it's more than that. Could he have kept some back, like stockpiling?
Okay, BP's dropping. Come on, Frankie, you've got to help us out here.
Frankie, how many have you taken? 10? 15? 20? 20? 20. Okay, let's increase the desferrioxamine to 2 grams per hour and can I have a blood gas, please. Did you know this would happen to you, Frankie? You'll have serious gut problems for the rest of your life.
He wouldn't be the first person to do something stupid just to get a day out of prison.
So what, you saying you did this on purpose?
It's not what you think. Mum, listen to me.
You haven't changed at all, have you? You never grow up, you never accept responsibility.
You wouldn't come.
I'm done. BP's 80 over 55.
Okay, he's in shock. Can we hang up another litre of saline?
Can you get those off, please? I said get them off.
I'm going to take you up to the cardiothoracic ward soon.
Have you told them your real name?
No, of course not.
And Jackie? Who is she?
Jackie.
The doctor said that she came to see you.
Well, then the doctor is lying.
Why would he do that?
Because he thinks we might have something to do with the accident. I don't know. Why do you think? What's wrong? Where are you going? Eve, wait.
Come on, mate. You okay?
Got 2 rates rising.
He's dislodged the chest drain.
Need to do another one?
No, it's not fully out. We'll try and inset it by advancing the tube. Hang on. That's okay. Can I get a suture?
Caleb? Yep, on it.
That's not looking too smart.
Can you call the blood bank and request 2 units of cross-match blood urgently? The tube must have exacerbated hemothorax.
Still losing a fair bit from the drain.
Really reluctant to clamp the tube. Let's get him a gram of tranexamic acid. Robin, how are we doing?
They're struggling. They've done a cross-match, but there's still a potential risk of reaction.
Well, just tell them to get it down here now.
Hang on. This guy's at risk of anaphylaxis. We shouldn't give him another transfusion unless we absolutely have to.
Look, he's already had a fairly big bleed. The chances are this will lead to another.
Now, look at him. He's stable enough for us to hang on a few moments. Give the TXA a chance to work. Trust me, Ethan.
Okay, 10 minutes. Let's keep a close eye here, please.
Maggie? Maggie, wait. Frankie didn't make himself ill to get out of prison. He did it to see you. If you don't come back in with me now, there may not be another chance.
can't tell him it's okay. I can't. That'd be like saying the last 2 years were for nothing. I thought by turning him away, I could help him to understand what he'd done, you know. But seeing him in there, it's the same old Frankie. It's all about him. It's all about what he's suffered.
You don't think you could be the one to change him?
He's never shown a shred of remorse. Not when the police came knocking, not in court, when he couldn't even look Alan in the eye. Alan Chadwick is in his 80s now. Frankie broke into Alan's house. And he fractured his skull. He frightened him to death. Well, for what? A couple of quid? I assume for drugs or whatever it was for. What would you say to somebody who's capable of that, eh?
But I do know that he risked his health, his life, to get you here.
Eve Devereux, I'd like to ask you a few questions about what happened today. DCI Jackie Pryor.
Jackie?
How did you do this to me, Rob?
Eve, please.
You shared my flat, my bed. You made promises.
I meant them.
I don't even know who you are.
I love you.
So many lies. I can't even bear to look at you.
Just give it time.
I'm pregnant.
It's early days, but he's stable.
Tell me why, Frankie.
I don't know. I should never have come here.
Wait. Come on, Frankie. You brought your mum all this way. You can do better than that.
I needed money, I did. I knew he had his pension. He was just some old bloke. I thought it'd be easy, but he wouldn't hand it over. He started shouting at us. I needed them to stop, to shut up. And then he goes all quiet. And he's just staring at us. All this blood over him. Just looking at us with this look on his face like he was... I don't know. Disappointed. And I felt sick. You want me to apologise, but it's not enough. It doesn't change anything.
I have something.
I'm not putting in for parole. I won't harass you no more. No more letters, no more phone calls.
All right. We'll see, okay?
Thought he was heading for a massive hemothorax. Good call.
So how long have you known?
Long enough.
Well, his sats are right back up there. Resps and pulse rate are normal. So we're good to move him as soon as the ward gets the
Dr. Hannah, can I have a word?
Can you just give me a minute? Everything okay in here? Right.
Back. Ah. I wondered how long it would take. How's it gonna come?
Yeah.
I've had Noel and Louise driving me mad with their gossiping.
Yeah. It should have been me, Mac.
Oh, and that would make you feel better, would it? I'm starting to see a pattern hereby. The bloke that won't wait for fire crews or backup. That goes charging in no matter how dangerous it is as long as he can save somebody. To play the hero.
That's the last thing I am.
I know. Because it's not about that, is it? It's about trying to redeem yourself. But the trouble is, if you put yourself at risk, other people can get hurt.
I know. If I could change anything.
Yeah, well, you can. Okay? You go see Dixie, you get some time off, you get help, and you get sorted. All right?
Cheers, pal.
taking you to the station. She's been remarkably unhelpful, of course, but your testimony will make the case.
There's not going to be one.
What?
I was there, Jackie. I planted it. The stinger. It was me.
Don't do this, Rob. I won't protect you. You'll be thrown to the wolves. Your life's gone. It's over.
Hey, how you feeling? You know, I've just had her in here asking if she'd stay on longer.
Really?
Oh, I couldn't believe it either after everything that's happened.
What did you say?
I said, I'll think about it. I'm just making her suffer, really. And then I had Cal in here asking for a permanent position. Don't know how that's going to shape up with Ethan.
I think you should say yes.
What, to Cal?
To Lily.
Are you joking? This is the same woman who got your written warning today.
I think I misjudged her.
In that case, so is everyone else in the ED. You do know there's talk of a big bash in the pub tonight to celebrate her leaving.
I know she's still got a lot to learn.
Are you serious? You really want me to agree to this?
Yes. Yes, I do.
So am I going to get to make the tea now?
I'm sure you'll find some other skivvy.
Come here. Group hug.
Oh, no.
No, come on, come on, come on.
Your tea's rubbish, your tea's rubbish.
Good luck, mate.
Thanks for everything.
How about we spend an hour cleaning up the place, and then I rent us a DVD? There's a great new rom-com I want to watch.
Every time. Yeah.
What?
I'm seeing a friend tonight.
I got tickets for a gig, so, yeah. I can't say it's been a massive pleasure.
That's what I was going to tell you. There's a permanent position. I'm going to be sticking around for a while.
I had a horrible feeling you were going to say that.
Oh, come on. From the looks of today, I reckon you need me here. I reckon I saved your skin back there.
Oh, you're that delusional.
Come on, you're on track.
Charlie.
Ash.
Ancient history. Just so you know, we probably won't be losing our favourite